Hi, everybody. I'm Dr. Isaac Halliday, owner of Lodestar Physical Therapy. I am here with my lovely friend, Mindy Wade. She's a family nurse practitioner and the co-founder of Balanced Body Integrative Medicine and Beauty. Her passion is helping you feel as vibrant on the inside as you look on the outside, and believes that true health requires a highly personalized approach. She specializes in optimizing hormones and crafting customized treatment plans that blend advanced medical aesthetics with integrative wellness. Her goal is to help you unlock your best self, achieving lasting total wellness. Mindy, thanks for coming on.
Thank you so much for having me.
Yeah,
Excited
so
about this.
so excited. It's been in the works for a while and we finally got it. And you're here on your birthday.
I'm here on
So
my birthday
happy
because
birthday.
because I took my birthday off and I was like, oh, this is a great opportunity to hang out with Isaac.
I'm like, what a better time to hang out with Mindy on her
Right.
birthday. So
Right.
happy birthday.
Thank you so
Now,
much.
everybody who watches this knows that your birthday
That
is
I'm
July
celebrating
16th.
the 20th anniversary of my 26th birthday.
Yes, I
Uh,
love it. I love it. Hey, how did you even like get into like what started Malice Body? How did you get into what you do? Tell us
that
about
is such a
your path. Yeah.
yeah, beautiful loaded question. Um, so I started in healthcare when I was like 18. I didn't know what I wanted to do when I grew up. I had a friend that said, become a CNA, get a job in the hospital, and see if it's something that you'd be interested in. And so I did, and I found a love for nursing. So I went, while working in the hospital, I went through nursing school. And then I went and got my bachelor's degree in nursing. And then after working as a nurse for 13 years, one of my best friends begged me to go back to NP school with her. And I was like, I don't know. I'm kind of like cool with where I'm at. And she's like, please just do it. I'm like, I really just don't think that that is the path for me. And she's like, just apply. And I did, and I got in. So in between my journey of education, um, when I was about 28, my husband and I decided we wanted to try to conceive children. We thought like we have our stuff together, we have a house, we have careers, like things are great, like let's start a family. And we shortly found out that I was going into menopause, and I was 29 when I found that out.
Whoa.
And I wasn't having like the classic signs of perimenopause that I didn't even know what it was. Like I was a registered nurse, I worked in healthcare, I had no idea that this could even happen. And um, so I was going through perimenopause while trying to conceive, doing fertility
Hmm.
treatments. So I was having like the brain fog and the migraines and the extreme mood swings that go along with that. Any person that has gone through perimenopause or going through it now understands what it's like. You have extreme fatigue, and it's hard to build muscle, and there's a lot of things that go on during that. um, Eventually I was able to conceive, but I did end up using donor eggs. So my husband and I'm not related to my children, so I carried them. I used some other woman's eggs, I carried them, and I had them when I was 35 years old. My last menstruation before that IVF was like 4 months before that. Like I started having hot flashes and night sweats, and I begged my fertility doctor. I was like, I know that we're doing an IVF soon and we need to line it up, but as soon as I can start birth control, please do, because I cannot handle these symptoms. And so that's what we did to time the cycle for the IVF. I had to be on birth control for a few months because you have to line up my cycle
everything.
with the
Yeah.
donor cycle, and it's I'm sure it's like it's very has to be very precise.
Yeah.
And so after I had my twins, I never had a cycle after that.
Hmm.
And I went to my primary care provider because I went into menopause so young. Going to an OBGYN really triggered me. I didn't want to see pregnant
Yeah.
people, and I
Hmm.
wasn't going to have more children. I knew that the twins that I have were going to be the only children that I'd have. And so it wasn't necessary for me to continue to see an OBGYN for those things. And my primary care would not treat me for my menopause symptoms. She's like, you can work out to build your bones. We can put you on an SSRI, so like an antidepressant to treat your hot flashes.
Okay.
But it doesn't help with the brain fog, and it
Yeah.
doesn't help with, I mean, the SSRIs would maybe help with the mood changes, but it doesn't help with your sleep. There's so many things that were not being addressed in that setting. And so I actually found a person that does what I do now
Hmm.
that it really did change my life. I felt like I was maybe even younger than my 30s. Like I felt so much better than I had in 10 years. Like the brain fog went away, the hot flashes went away, like my skin, like I still have a lot of dryness in my skin, but my skin integrity improved so much because when your estrogen goes down, like your skin gets thinner and different things like that.
Yeah.
So those, I started seeing improvement in all those areas. Um, I was working as a nurse, and when one of my best friends, talked me into going to NP school, like while we were in school, we kind of we could do some specialty like clinical
Hmm.
hours, and I really tried to get into like a fertility clinic setting, but because um, like that world is so small, it's really
Hmm.
hard to get any hours in that setting.
Yeah.
So I was able to follow like a functional medicine nurse practitioner for a bit. And I also followed a dermatologist nurse practitioner at one of the prestigious hospital clinics in our community. And I found a love for both. I'm not functional medicine certified, but I do carry a lot of those philosophies. I'm trying to figure out like, what the underlying causes for certain things. It's my opinion that the underlying cause of menopause is your ovaries stop working, right? And if they're not making those hormones, then you need to replace those hormones. It will improve so many things across a person's lifespan. But I'm gonna kind of just focus on women, even though I do have
Hmm.
um, quite a population of men that I also treat for hormone replacement. Um, but to kind of talk about how I got here, um, knowing that I can help other women treat their menopausal, perimenopausal, even if they're not those things and they have like PMOS, also known as PCOS, uh, or PMDD, like I can help people with those things. And I'm passionate with helping people with those things.
Yeah. Yeah. Cool. It's always fun to see people like, I
Mhm.
had this, and
Mhm.
that's why I went to go do that, right?
Right.
A few things like, just so that everyone who sees this knows like when you're like, I went to NP school. What is NP school? What does it
So
entail?
we have an advanced license in
Hmm.
nursing. So we are clinicians. We are nurses that have gone through additional education so we can diagnose and prescribe medications.
Cool. Yeah. So that's where the nurse practitioner part comes from. So
Right,
like, what does that mean to them though, right? Like
right.
if I'm just my average Joe, I'm like, oh, cool, nurse
A lot of
practitioner,
people
MD. Great.
say, so you're kind of like a doctor. I don't like to say that
Mhm.
because physicians really do, they have a lot of education.
Yeah.
Um, it's just a different path to be able to practice similarly.
Yeah.
We all have our own like practice guidelines that we can practice. Hormone replacement is often done as like an off-label use of hormone replacement and
Hmm.
whatnot. Um, but I can diagnose and prescribe the, like a physician, I guess I
Yeah.
should say, if that
Yeah.
makes sense.
Yeah. I mean, it makes sense to me.
Yeah.
But yeah, I love it. And then like, I mean, so if someone's like, hey, I want to come see you, like they could just come straight to you, right? Because you have
They,
that NP
yep, they can come.
license.
Yeah, they can
Yeah.
come straight to me.
Yeah.
There doesn't need to be a referral. They can
Yeah.
just come to me.
Cool. That's awesome. And then yeah, going into this whole, I mean, you listed a lot of acronyms out there that I haven't heard of.
Oh, so sorry.
I'm like, I don't know what that is. I'm sure if someone has it, they'd be like, yeah, that's what I
Yeah,
got.
yeah, yeah, yeah.
Like POM,
PMO.
POM,
So it's
PMO.
so PCOS is polycystic ovarian syndrome, but it's now
Okay.
been renamed because it's really a metabolic syndrome.
Mm,
It's more than just the cysts on the ovaries, but it is a metabolic syndrome that causes people to have increased insulin, that causes weight gain, and it can cause high blood sugars or high insulin levels, making it difficult to lose weight. Um, a lot of people with this metabolic syndrome get cysts on their ovaries, and and testosterone gets too high, and then all of those things cause more cysts and more weight gain, but the weight gain causes more, like, so it's this terrible
just this
syndrome,
negative
this terrible
cycle that just,
cycle. So if you can get a
mm,
hold of that, we can manage the symptoms, we can help people lose weight, we can help them feel better. We can, if the person that has a syndrome, a lot of times um, it's people that were like born as women, they'll get a lot of facial hair. If they don't like that, we
mm,
can help remove the hair. There's a lot of things that we can do to help them feel and look good, um,
awesome.
to whatever that means for them.
To, yeah, to whatever their
Mhm.
definition of I feel good in this body is. Yeah,
Exactly.
I love it. That's so cool. So how
Mhm.
does like what is the process then of like they come to see you and then like where does it go from there? Because it
Yeah,
seems
so
complicated.
it depends. Like we have some people that come in and they're here for the aesthetics and they're like, "Oh, what
Yeah.
else do you do?" And then they're like, "Oh, I want to do my hormones. Oh, I'm having those symptoms." So it
Hmm.
can be like people that are like, "Oh, I just want to come in and have some Botox or Dysport or microneedling." And they're like, "Oh, I've really been interested in learning more about my hormones." Like, so there's that pathway. Or if somebody's coming in to see us for hormones first, then they usually it's by word of mouth. Most of our clients or patients, whatever we want to call them, are word of mouth. It's somebody else
Hmm.
that has, you know, a friend, a family member, a cousin. We do get some people that just Google hormone clinics near me, and then they look at the websites. And I we have a somebody that just started seeing us recently, and I asked her, "How did you find us?" And she said, "I was looking for a hormone clinic. I looked at your website. I saw that it was women owned and that it's a woman that is managing all of these things, and I felt connected to that." And so she came in, she met with us. They usually meet, typically, they come in, they call, they make an appointment. They meet with my sister, who's our registered nurse, and she does an intake. So she gets an intake of their symptoms. She draws their blood for the hormone panel. That's all done off of protocol. And then they will have an hour meeting with me where I go through every single one of their hormones, what that means and how that correlates to the symptoms that they're having. And then we come up with a treatment plan that works for them, because what would work for you would be something that
Yeah.
works different for me, which works
Mhm.
different for somebody else. So there's lots of different modalities of hormone replacement, and we want to make sure that it's safe, and and it's something that somebody can be consistent with. We don't, like, if somebody's really bad at like taking pills,
Mhm.
maybe we do something different for them, so that we can make sure that we're providing this as safely as possible.
Yeah. That's awesome. Yeah, like just being able to spend an hour with your provider and just going over things is, I think it's almost so foreign in today's medical world, right? Because
Right.
I mean, it's like you're in and out, like doctors and other NPs,
Mhm.
and you're also at a, uh family
Family medicine.
medicine
Mhm.
clinic, right?
Yeah.
And you're seeing how many patients a day there,
It depends on the
right?
day, but when we're dealing, I shouldn't say dealing, but when so in like a family medicine clinic that is insurance based,
Hmm.
um, it's a lot of times about volume.
Yeah,
So
yeah.
so visits are 15-20 minutes.
Hmm.
And so, for example, I can see anywhere from 20 to 28 patients a day,
Yeah.
depending on,
On
yeah, however they were
all of it.
scheduled,
Yep.
right?
Yep.
Because like I'm lucky at that clinic that we get a little extra time for like our new patients and
Yeah.
different things
That
like
is.
that. Or I can let the front desk know, like, this particular person needs a little bit extra time with me, so they'll schedule those a little bit longer.
Yeah.
But when you're looking at it from an insurance based payer
Hmm.
system, it really
Yeah.
it's not always the
It's not
it's
always.
about
Yeah.
volume.
It
Like,
is. Yep.
to make for a practice to run, you need to see
Hmm.
a lot of people.
Yep. Yep. It's
Hmm.
and but now they can come to you and be like, I get the whole hour. I
Right,
am taken care of, which is
right.
like so cool.
But that comes with a cash-based service, right?
Yep.
So
It does.
we get to be able to do that because it's cash. I shouldn't say cash, just out of
But
pocket
out
base.
of
Like, it's,
pocket. Yeah.
yeah. So it just makes it so that I get to spend that extra time that people need, because they deserve it,
Yeah.
and and so we have that
Hmm.
cash-based system.
Yeah. And they're able to use like HSA,
Yes.
and if they want to do out of network benefits and submit it to their out of network,
They can
they
do
can do
that.
that as well.
Yep, I
So
can create a super
yeah.
bill and they can submit it and see if their insurance will
Hmm.
reimburse. And
Yeah.
then labs, if they
It's
have
great.
insurance, the labs that I usually run are not always covered by insurance. I always,
Mm.
we discuss this with all of our patients, but I always recommend that they call their insurance first to see if the labs are covered through insurance. If they are, we can have them processed through LabCorp, but anything with that is through LabCorp. Like, we don't make any money off of that, right? Like,
Yeah.
it's just like we draw the blood and LabCorp. So if there's any
Yeah.
bills, it's through LabCorp. Um, but if they don't have insurance, which is becoming more and more common, we actually have a contract with a lab company that gives us good client bill pricing, and then we can run those. They just pay us for those labs, and then we pay the lab company to
Mm.
process the labs.
Yeah.
And again, there's not like an extra fee for us to do that. That's just our our cost for those labs, and we just use that and pay it directly to that lab company.
That's cool. That's cool. I kind of want to get that. I wrote down the questions and then we
Uh-huh.
here
Yeah.
we are. But like one of them, like from your story,
Uh-huh.
um, like do you feel like because you were going to your family physician, right? And do you feel like that they didn't treat you not necessarily because they didn't want to, or just because they're like, I don't know how to treat this? Because I feel like family as much as family medicine is needed, there
Mhm.
are times when it's like you can only know so much or be good at so much, right?
Well,
Like,
menopause care is part of family medicine practice.
is it
Um,
okay?
so, so treating a woman with estrogen and progesterone, um, is, you can do that.
Hmm.
Treating a woman with testosterone, which women's ovaries make testosterone, and that depletes as we age because our ovaries aren't making that as much. That is
Hmm.
not the standard of care. So that would not be done through a family medicine clinic. That's
Oh,
another reason
yeah,
why we're cash based,
yeah,
because that's not something that you would do in a family medicine setting. That said, um, the provider that I saw, um, it was still it was still quite nuanced. Like there's still a lot of pushback from people that maybe were educated
mm,
for like years before I was, where they're like, if you give women estrogen, they're going to get cancer, and
oh,
it's not true that
right,
but the standard of care was like you can treat with estrogen and progesterone, but only for 10 years. But also
mm,
there's not really any data that says like after 10 years you need to stop the hormone
right,
replacement because there's a lot of benefits. It really is
yeah,
preventative medicine, and it needs to be
hmm,
looked at as preventative medicine. Like estrogen decreases your risk for dementia, osteoporosis, urinary tract infections. There's so many things that it actually
yeah,
helps with. And I think there was a huge population of baby boomers that were like, they were given a disservice because they weren't treated for those things.
yeah, yeah. I think that leads into I mean, a lot of misconceptions around hormones, right?
Hmm.
Like
Right.
there's a lot.
Uh-huh.
And you went into a few of them. Are there other ones that you like hear all the time when people are like, but
I
I
still
don't
get
want
a
to see
lot
you
of women that
because yeah.
worry about the cancer risk.
Hmm.
There are like they've done some, uh, looking back at like past data. Um, they've found that women that start on hormone replacement before they go into menopause are at lower risk for heart disease, and they're at lower risk for osteoporosis than and breast cancer than
Yeah.
those that were not started on hormone replacement. The studies that were done with synthetic hormones, and and what they were finding is so kind of the old philosophy was if a woman didn't have a uterus, you didn't need to be on progesterone. Um, they would treat women with a synthetic progestin. And so the women that were still had a uterus that needed that progesterone to protect their uterus, um, they were given this synthetic progestin. They found that it was probably that was increasing the risk just a little bit for breast cancer. And so they saw this uptick in the breast cancer, and they're like, "Oh my gosh, we have to stop the study. This is causing cancer." But they thought it was the estrogen.
Hmm.
Now that they're looking back at those studies, they're like, "We interpreted this data wrong." The women that were on only estrogen that don't have uteruses actually had a decreased rate of cancer. And now they're finding that like the bioidentical, and bioidentical is, um, I, I use that term because that is what people are used to. But if you get your progesterone from any commercial pharmacy, if it's a micronized progesterone or an estradiol, that is bioidentical. That said, I do often use compounding pharmacies because um, I see a lot of shortages in commercial hormone replacement. Like right now, a lot of my patients that are using estradiol patches can't get their patches because they're all back ordered. I also there was a few probably about a year ago, women couldn't get their progesterone.
Hmm.
And if you're going to be on estrogen and you have a uterus, you have to be on progesterone because it protects that uterine
Hmm.
lining. And so I was like, well, let's have you get your progesterone from a compounding pharmacy. Um, Another thing that I like about compounding pharmacies is that when you're getting commercial based hormone replacement, it's like this is your dose and that's what you can get. With a compounding pharmacy, maybe when 100 milligrams isn't enough progesterone for somebody, but 200 makes them really tired
Yeah.
because it helps with sleep and different things, but maybe they're groggy the next day. So I can have that compounded for 150 milligrams,
Mhm.
and that's not commercially available.
Right.
But that also, then we run into that if somebody wants to use their insurance, it may not be covered through
Th-
insurance.
Then it's, yeah, now it's
Mhm.
like, oh, but it's a compound, so we can't.
Right. But
Yeah.
um like what I love
Yeah.
about compounding pharmacies also is that they're privately owned, and
Hmm.
I have a relationship with those pharmacists, right?
Yeah.
I can call or text their cell phone numbers if I have a question about something, or if they have a question about something.
Yeah.
It's nice to
That's
have that
cool.
relationship with your pharmacist.
Yeah. That's awesome.
Mhm.
Um, yeah, so other than
So
um
those other misconceptions
yeah, there's
besides that,
like that, and then also like with the misconceptions of like, because you do more than just hormone stuff too. You do
yeah,
like beauty stuff. So
yeah.
like I think there's a lot of misconceptions
So
about that stuff too, right?
exactly. So a lot of people think that aesthetics is like can maybe be like a superficial thing, and it really isn't. And if you feel good inside, people also want to feel good on the outside.
Mhm.
Um, if your hormones are optimized, your skin integrity is going to be better, and there are certain procedures that we can do to just help refreshen your look. Um, so so I get a lot of women that come in and they're like, I have all these wrinkles. Well, let's do a little bit of Dysport. We can like I haven't done like you can see like how much movement I have in my face. I haven't done my Dysport in like 6 months. But if I maintain it um with the hormone replacement, I tend to get a longer lasting effect out of those treatments. But I also ask our clients and our patients, like, what is your goal? Because there are some women that are like, I want to be frozen. I don't want to have, like, I don't want to be able to give that dirty look to somebody. I don't want them to be able to read my facial expressions. And then we get a lot of people that are like, I really just want to look more rested. So they want maybe some more movement. So
Yeah.
we can um what's the word I'm looking for? We can craft something for them that meets their goals.
Yeah.
So
And makes them feel good
yeah,
for what
exactly.
they want to feel good
Right.
for. Yeah.
Exactly.
That's
Exactly.
cool.
So we do have like the InMode Optimus Max machine that does like laser hair removal, and it does microneedling, and we can get rid of like age spots. That's another thing
Mhm.
that happens as we get older, as we start getting these age spots. We can help with minimizing the appearance of those, or help get rid of those age spots so that they feel better about themselves.
Yeah. And look younger forever.
Right, right.
You're the fountain of youth, is what you're saying.
No, but it's really funny because I went to a
I love
concert.
it.
I went to the Ziggy Marley concert a few weeks ago,
Uh-huh.
and we snuck our way to like as close as you could get on the grass area at Red Butte. And there was like this group of friends that we sat by, and like they were really nice, and we were talking, and they were asking our ages, and he asked me how old I was, and I said I'm 46, and he was like, no way. I'm like, I am 40. I'll be 46 in a month. Like I'm well, now I am today,
Yeah.
46. And he was like, I am only 3 years older than you. Like, and what I took away from that is like,
Mhm.
he basically thought that I was like in my early 30s. But
Yeah.
really, I think part of it is that because I mean, we've only had this business for 7 years, but I've been on hormone replacement for 10.
Hmm.
So being able to introduce that earlier, I think has helped maintain my skin integrity. But also now that I own this practice, I can do the microneedling and the laser hair
Yeah.
removal and all of those things too. But I prefer a more like I don't want to say natural, but I prefer a more natural look.
Hmm.
And so when you look at me, you probably don't think, oh my gosh, it has so much filler in her face, or like I really just
Yeah.
want to look refreshed and well slept.
Yeah. Yes. I wish I was well slept.
Sometimes I wish I was too, it's because I do still have
But
twins.
but you at least you look well
Yeah,
slept whether you are or not.
right, right. Between my twins, well, mostly my daughter and my pets, I am not well slept right now.
Yeah.
So, but at least I look well slept.
That's no, it's
Mm,
awesome.
mm.
It's great. And I'm like looking at the camera. I'm like just like, oh no.
I do that every day, and I'm like, I need
Not
to do, but then I'm like, but do I?
like
When am I
whatever.
going to find like another part
Yeah.
of owning your own practice is when do I get to do those treatments on myself? It's not very often. So it's really funny. Like the last time I had something, my sister's like, I'm going to run this laser over you really quick between your two patients. We have 10 minutes.
You're like, okay,
I'm like,
let's do
I'm down. I'm ready.
it. Love it.
Mm,
I love it. So yeah, when I don't know, when someone is like, hey, like when should they be like, hey, these are the markers of like, hey, I need to call Mindy. Like what is it that will trigger that you're like, hey, if these things happen, like this is what I will
right.
be able to help you with. Yeah.
So men and women alike, um, one of the first things that they notice is weight gain without changing what they're eating or their exercise habits.
Mhm.
Okay, so that's telling us that there's probably a decline in the hormones. They're having a harder time building muscle, a harder time losing weight, but they're still eating and exercising and doing all the things the same that they've always done. So, so that's one thing that often leads people in here. Men, they'll notice that maybe um, they they don't have maybe the desire to be intimate with their partners as much. Um, that's more common in middle-aged women. Um, that is a really big symptom of perimenopause is that they still like their partner, but they have no desire to want to be intimate with their partner. So the lack of desire, um, being tired of being tired. Like you get plenty of sleep, but you are so tired all of the time. And things maybe haven't changed, but you're just tired. Um, it could be they're wired but tired. Like they go all day long and then they go to lay down and they're like, I wish I could fall asleep. I am so tired. I wish I could fall asleep. So that's another symptom that people have. For women, they often start getting urinary tract infections, vaginal dryness. Um, they notice that maybe they're thin, their skin is getting thinner. Um, they are noticing um, maybe starting to get irregular periods, like their periods are becoming like closer together or they're becoming further apart. So those are all kind of symptoms that this may be related to hormones.
Cool. Um, yeah, I'm like, maybe I should use you.
Yeah, yeah, come in.
The
We'll
the
evaluate
weight,
you.
yeah, the weight gain that has happened lately. I mean, I'm sure the many dozens of donuts I've eaten the last few months and ice cream have not helped.
I was telling my neighbor the other day, no, it wasn't my neighbor, it was my son who was having a sleepover, and and I don't know how it even came up, but I was like, well, my dinner tonight is chips and a glass of wine. So that's just this is how much bandwidth I have right now. I'm
Yeah,
not going to
yeah.
cook anything. I'm just
I'm just
this
gonna,
is it. I'm having chips and
this is
salsa.
what I have.
Yep. This is what I don't
Yeah,
have to make any effort into doing.
yeah.
So,
Oh, that's awesome. That's cool. And how can they get a hold of you?
okay. So they can go to our website. Our website is balancebodyutah.com. We have a Facebook page. Um, our Facebook is Balance Body Med Spa. And then we have an Instagram page. Um, let's see what our Instagram page is. I'm the worst. Uh, our Instagram page is balance_body_Utah, or you can call us. If we don't answer, that just means that we are with clients. Oh, did I lose you?
No, I'm here. No,
Okay.
sorry. I
No,
just clicked out to look at, yeah, no,
no,
we're
I
good.
closed the window so I
Oh.
couldn't see you. Um, our phone number is 801-820-4462. If we don't answer, that just means that we're helping somebody. We're a really small family owned clinic. So we have our office manager, who is my brother in law, our registered nurse, which is my sister Cindy, and then me. And so between the three of us, we do monitor that phone line. But if we don't answer, it's because we're helping somebody.
Yeah, cool. Very good. Is there anything else that like we didn't touch on that you want to bring up?
That nobody has to suffer feeling like crap.
Yeah.
Like you don't need to feel that way, and we can help you feel better. And if it's not hormones, I can help direct you to where you need to go to get the help that you need. um and that you know we can help you feel and look good. We can help you be your best. You can have good vitality, and we can help optimize your health, and we can help you reclaim who you used to be um, in your early 20s, whatever that was for you, your best
Awesome.
self.
Awesome. I love it. So there you go, everybody. Give Mindy a call and
Please.
just feel beautiful inside and out, and it's going to be awesome. So
Yeah. Yeah.
anyway, go enjoy your birthday, eat
Thank you.
lots of cake and ice
I'm not
cream.
going to eat any cake. I don't like cake, but I'm going to have
What?
ice. I'll have ice cream.
Ice cream. Okay.
I'll
Ice
have ice cream,
cream.
but I'm not a good.
Donuts. Donuts.
Donuts are okay. I'm
Mindy.
more of a savory kind of girl, but I do love
Okay.
myself some ice cream.
All right. Ice cream it is.
Yeah.
Okay.
Yeah.
All
Thank
right,
you so
cool.
much. It was so fun.
Yes. Thanks for
Thanks for
coming
hanging out
on.
with me on my birthday.
Absolutely. Okay. We'll
Okay.
talk to you later.
Okay. Take
Bye.
care.